I'm visiting York to give a lecture in the University of York's Open Series events, and it's an absolute honour to have the opportunity to talk not only to staff and students, but the general public as well. I've known Professor Carl Atkin actually since the 90s, the mid to late 90s, when we started our collaboration on sickle cell. And it's wonderful, I have to say, to have followed his career and to see him now as head of the Department of Health Sciences here in the prestigious University of York. It's absolutely fantastic. One of the areas that I'm really proud of is collaborating with Carl in a landmark book called The Politics of Sickle Cell and Thalassemia that was published by the Open University Press, and apparently is one of their bestsellers. And the reason I believe it's had such recognition and received such acclaim is that we've addressed the much wider historical issue of mapping how this condition came from just not really being on the NHS agenda to now being much more firmly on the agenda, with the subsequent outcome of better quality of care for families up and down the country. And we found that from my nursing perspective and Carl's sociological perspective, we were drawn together in trying to see what we could contribute to redress the inequalities in the provision of quality services for families affected by the condition. If I was to start over again, I would be attracted to a department of nursing such as the one run by the University of York, because I think it is a little bit unusual that it takes a much broader approach in terms of looking at the wider dimensions of health. It has excellent reputation, for example, in how it's addressing diversity issues. Because not every university is addressing that. Not every college of nursing is addressing that. And therefore, to know that you are going to get the best of both worlds, you're going to get an extremely rounded academic experience and professional experience in respect to coming out at the end as a nurse who could hold their head up anywhere in the United Kingdom, in any branch, in any setting. And you come here, I would have thought you'd have some pretty good prospects of employment in all sorts of areas that, maybe they may not have realised when they first started.